Hello, everyone. Thank you very much for joining Blockchain UBC monthly speaker series, the June event. And today we have Dr. Brigitte Piniewski joining us. And Dr. Brigitte is a physician, and he's a tribalizing figure at the intersection of medicine, decentralized technology, and AI. And she has been working at the forefront of the Web3 healthcare space for quite some time. And she captivates audiences with a clear and actionable perspective on the immense possibilities of securely channeling crowdsourced health expression data sets for unparalleled AI training. And she recently published a seminal book, Wealth Care, Demystifying Web3 and the Rise of Personal Data Economics. And this book is also available as an NFT. It's an essential guide for anyone aiming to spearhead innovations in healthcare. And today, her presentation is titled AI in Health is Overrated. Find out what's missing and why. So without further ado, let's welcome Dr. Brigitte.
Thanks so much, Jen.
Thank you.
Welcome, everyone. I'm so excited to see you here. I'm realizing that my slides are not advancing. Is there another way of doing it? Oh, I fixed it. So quick background about myself, quick shout out to UBC and UBC Medical School for accepting me. If they had said no, my life would have been quite different. Actually, they did say no. They said no the first time because they looked at me and said, Piniewski, you have no chemistry, no biochemistry. We can't let you in with just math, physics, and languages is what I was studying, thinking that I might be an interpreter at some point. But second time around, I did do the requested chemistry and biology, biochemistry, and then I got in the second time I applied. And so thank you to UBC Medical School. Focused on primary care with obstetrics. I did a lot of deliveries in the early days. Thought if we just did those 9 months correctly, we'd be launching all our babies off to 100 years of good health. That wasn't true. As I learned, as I practiced medicine, became chief medical officer for a large reference lab in the Pacific Northwest. And with that work, started to work with Intel and Qualcomm with a group called Continua Health Alliance. This moved me into using more and more technology in health and recognizing that the health system itself needed significant revamping based on current conditions on the ground. Since that time, I've helped investors with investor education around blockchain, Web3, and that's what really got me excited about the use of these technologies in healthcare. Currently, my day job is with a group called NextCube. They're an incubator and accelerator out of San Francisco and San Diego that focus on frontier tech, AI and ML. And I'm also part of the US Blockchain Coalition with the vice chair for the West region. And then the Global Business Blockchain Council, I'm a healthcare ambassador for that. So let's jump into our discussion. Back about a year ago now, the A16Z came out with a paper suggesting that the biggest company in the world would actually be a healthcare company. And that sort of sets the framework for suggesting that we, at this time in our evolution as humanity, are at a forefront, a time when we can build something very different than what we have today, in that the current models, of course, were developed, built, and erected prior to the internet, prior to AI. And now we're sort of at that third leg of the stool. We've got the internet, we've got AI. What's left now is figuring out how to connect these new technologies to humanity in safe and secure ways. Well, it doesn't work that way, this way. So thinking about a new company, a new massive company, we would have to consider how much the world, the planet, has changed on our watch. Right now, we have an explosion of health harms that we're completely unaware of that happen on a day-to-day basis throughout our daily maneuvers. Microplastics are a problem, fertilizers, environmental toxins. We don't see them in the grass that's growing in front of our yards. The hair products have been associated with cancers, and we think of hair products as being completely external to the body. How much harm can they possibly generate? And yet we've had some really significant outcomes. Of course, medicines have always had side effects, and many of which can remain hidden for years while you're taking medications. And then, of course, processed foods. There's something like over 8,000 various chemicals inside the food that we eat today that we may or may not be aware of. The other thing that I think this new company should think about is that healthcare up until now has been completely built on population intelligence. So, for instance, if we take any of the intelligence, it's based on a study population, which means that providing a recommended therapy to a study population makes sense. If I take 2,000 people and say you should increase your activity, then that population will do better if they increase their activity. But on an individual basis, it's really, really imprecise. The chances of an individual being able to utilize information like do more exercise is incredibly varied. So perhaps a more specific recommendation would be, watch this podcast, read these books, participate in these group sessions, and then eventually get to the point where you're willing to do more exercise. And so I think that that's important to understand that when we are working with intelligence that is based on populations, the vast majority of outcomes are only going to be average, because that's what happens with populations. The big bulk of the outcome is average. It's not optimal. And ideally, we would like to have, for each of us, a chance to have an optimal outcome, which is at the tail end of the bell curve. But the information that underpins why only a handful of folks have an optimal outcome doesn't exist in the EMR. It has to do with host and host exposures, social factors, all sorts of parameters that are not documented in the EMR. And so this gives us an opportunity to think about a new health system that would make it possible for us to have access to who was an outlier, who achieved an outlier outcome, and what are the parameters that are associated with that event at the end of the day. And so I think that we need to recognize that all clinical guidelines are based on populations. They're not based on individuals. And so, in fact, even a simple example like lipid lowering. I mean, we provide medications to folks on a regular basis to lower their lipids, and yet the numbers needed to treat for statin therapy is like 200. What does that mean? That means that I need to prescribe the same medication to 200 people. They need to take that medication every day for 5 years in order to have avoided one cardiac event. And that helps us understand that sort of daunting imprecision that is part of the way we practice medicine day in, day out. That means 199 people have been taking that medication for 5 years. We don't know which ones they are, but they did not receive the health benefit that they expected to receive from that medication. One person did. We don't know which person that is. And yet the numbers needed to harm is much lower. As I said, the numbers needed to treat was 200. The numbers needed to harm is only 30. So by prescribing that same medication to 30 individuals, I can be quite confident of harming somebody by the time I've written 30 prescriptions. But helping someone, I need to write 200 prescriptions over 5 years to avoid that one cardiac event. So hopefully these are some of the examples that help us highlight just how imprecise the current model is and how much room there is for the new technology to provide much more precision at an individual level to create a much better opportunity for us to understand who's going to benefit from what therapy at what time. Go ahead and interrupt any time, Chen, if there are any questions or comments that would highlight.
So I don't see questions in the chat yet, but if you have any questions, I mean the audience, if you have any questions, please type in the chat. Brigitte will be happy to answer them along the way. Yeah.
Great, thanks. So yes, following on this massive amount of, explosion of health harms, plus incredible imprecision that is under, shall I say, documented, or it's under trumpeted, I would say, in healthcare. We don't trumpet our imprecision very much. But what really moved me in this direction was, as I said, in the beginning, I thought it would, if we just did those 9 months of pregnancy really well and a safe delivery, we would launch everybody into 100 years of good health. That was completely wrong, as I started to see more and more young people, and young people that had gone through puberty in ways that were unexpected. So, I used to think it took 4 decades of suboptimal lifestyle to give you diabetes, heart disease, stroke. But what the younger folks taught me is that just 4 years, so 4, not 40, years of puberty, which older generations used to just go in one end and come out the other, not even give it a thought. But with conditions on the ground today, it is possible to have hormonal alterations or hormonally altered puberties such that you are moving towards early onset of diabetes, heart disease, stroke, but not just the physical manifestations, but also the impact on your social cohesiveness, your ability to be employed, all sorts of domains of human function can be impaired dramatically during this tiny, tiny period in someone's life, these 4 years during your teen years, when you have no ability to provide informed consent. And so that's what really pushed me to start to do work in this direction. And what we're seeing more and more as well is this early onset of cancer, where previous generations used to expect that the chronic diseases of aging and cancer was one of these things that happened when you were old, when your immune system petered out to some degree, and now missteps, cellular missteps could not be corrected in time. But what we're seeing, of course, now in the last 3 decades, there's been a 12% increase in the rate of cancer, and especially amongst younger individuals. And so clearly our current model, the way we do cancer screening and treatments are insufficient to protect younger and younger individuals. And I'm thinking of Steve Jobs and Kate Middleton, both of which are being diagnosed with cancer at a time in their life when they were, still having a young family, busy, employed, and clearly not at all sort of paying attention to the minutiae of their lives that might have, if we had a better system in place, this new model that we're talking about, that might have protected them from this happening. That's, I think, the way we want to set up this new biggest company in the world. We need it to have that ability to detect at the earliest possible moment when corrective actions are recommended or required. The last one there, Clay, I would mention, is a colleague of mine who, again, did everything you would expect to be correct. Big runner, long distance runner, didn't smoke, didn't drink, seemed to have no vices, and then accidentally showed up with cancer, probably delayed diagnosis because it was a very rare cancer in North America. He was a tech exec, so traveled a lot across the world, spent a lot of time in China as well. And you worry that his cancer, that is, as I said, rare in North America, is actually very common in China, is a nasal cancer associated with air quality. And again, could it have been possible for him to even understand that X amount of air quality exposure would be exceed the level at which he would still be safe from these diagnoses? And so that's what we're looking at, is a company, a future company that has that ability to aggregate the minutia of our lives and be able to warn us well before we're stuck with a diagnosis that there is no returning from. So can we do this? And actually, I think Denmark is proving to us that we actually can do this. The Denmark study is, and I should maybe back up a little bit and say that these articles that I'm talking about here, I'm mentioning them briefly, but if you would like more detail about them, these images that you're seeing here are the images, like this is on my LinkedIn. So if you want the article in more detail, that's the A16Z article. This is the article about no longer being accidentally well. And others throughout this presentation. I just took the same images so that you could find them very easily on my LinkedIn. So Denmark, I didn't put the references in here, but they're all in the articles in LinkedIn. So keeping the slides clean here. The Denmark study, they took 6 million people and realized that they had very robust training data for large language models, because life is a sequential event. Things happen. You grow, you're born, you go to school, you get a job that has a certain wage, a certain hours associated with it, you live in a certain location. And these large language models were able to very robustly understand by looking at data up until, I think they had about 10 years of data up to 2016, plus another 4 years of data up to 2020. So they used the data up to 2016 as training data and looked to see if that large language model could predict survivability in the next 4 years. And their next 4 years proved out that their training model, the training data and the model was very robust, more so than usual. This is what the study looks like by Germans and et al. And here's a glimpse at some of the things that they were looking at with respect to building that embedding space and looking at the correlations between various lived experiences and the relationship to ultimate survivability in the next 4 years. So that brings us to the big point of this whole talk, is the fact that what happened in Denmark with 6 million people, that's not a scalable or translatable model to the rest of the world, because most places on the planet are places where people do not want their government to have a large amount of detailed information about themselves. Because what we're talking about here is clearly that health data is a set of data that doesn't reside currently in industry or government. I mean, healthcare has a lot of disease management and billing data, but that health data, the air quality that I've been exposed to, the pesticides in the lawn in my yard, the hair products that I'm using, the social cohesiveness I have amongst my peers, et cetera, these things are not in current repositories and probably shouldn't be controlled by industry. And I think that this is a place where there's an opportunity to build a new relationship with the citizenry. The citizenry still has their entire lived experience is a physical expression, which AI can't do anything in the face of physical phenomena. But by using wearables and apps, we can increasingly convert that physical health expression, such as sleep, movement, nutrition, into zeros and ones to make it readily available for AI to consume and to teach us at an, just in time manner what matters to each of us at any time. So I think this is a huge opportunity for the planet to do or to build that third leg of the stool. We have AI, we have the internet, we have AI, and now we need this third leg, which is how do we now protect living biological units, each of us on the planet, in robust ways that the minutiae of our lives can be digitized and explored by AI. And to this end, I, as you mentioned, wrote the book because in COVID, my contracting work had reduced, and I thought there's no excuses anymore. I've seen all these patients. These patients have taught me over the decades, what's really happening on the ground, and I felt the responsibility to make sure I put words to paper and explain the not just the medical necessity and the urgency of doing things differently, but also a bit of a blueprint, a high-level blueprint as to how things would look if we were able to do it differently. And so the details are, as I mentioned, some of them are on the LinkedIn in those articles, but a longer version is Wealth Care, Demystifying Web3 and the Rise of Personal Data Economies, which is published just last year, available as a book on Amazon and as an NFT on OpenSea and Alexandria Labs. So what we go into in the book, of course, is this medical urgency around puberty. Every 4 years, each cohort has this opportunity to really impair their future health potential in ways that older generations didn't have an issue with. I always say that we're the last of the accidentally well. Parents at earlier times did not need to know how to, manage their child's sleep or movement or nutrition. The cohorts basically got access to their genetic potential without necessarily earning or deserving it. That's not there on the ground today. Things have changed so much that food is not food. Food is factory food now. Movement is no longer necessary. I mean, older generations would have to move or their brain would go stir crazy. And now with very engaging screens, you can keep the brain busy for, basically 24/7. And their brain will be so enticed with a game or whatever you're reading on the screen that it isn't distracting you to get out and go move yourself in any way. And so this talks about a 3-zone model, where zone 1 acts as your home base. Think of that as a place, a repository where you would just dump all your information. And, you think that you would put your wearable information in there, your lab values, any visits to clinics or hospitals in such a way that it's always easily accessible to yourself, regardless of where you find yourself on the planet. And that this home base can participate with what's called Zone 2, which is a continuous correlation AI that is non-rivalrous in every way. So no IP, no commercialization in Zone 2, simply showing us what is correlated with what. And you can ask any specific questions that you might have. You can have migraines and want to know whether there's a particular yoga that works well for migraines. That's something you as an N of 1 would have a lot of trouble trying to sort out. But going to your cohort, the correlation AI can find individuals that have similar patterns of migraines that you have and pull out which correlations or which co-occurrences are more important in terms of alleviating migraines than others and make that available to you. And then Zone 3 is this final layer that is separated from Zone 1 and 2, and that's everybody else, industry, government, researchers, and others that need and want crowd-based intelligence, that want access to those insights. And so the insights can be served up to Zone 3 on a pre-approved manner in such a way that individual identity remains hidden behind Zone 1. And so this is a high-level view of how using technologies such as blockchain, Web3, AI could make it safe for us as individuals to digitize the minutiae of our lives and participate in crafting individual-specific intelligence for ourselves as well as each other, and to use our data as an economic asset for ourselves as we participate in different marketplaces. Today, there's a handful of companies that transact on our data on a regular basis. Think Amazon, Google, Meta, etc. But imagine a future where all of us are transacting on our data on a regular basis, where we're asking very specific questions. What is the out-of-pocket payments that I should expect if I'm going to have X procedure in this location? Google makes that very difficult for us currently, but if we had this massive resource, this fire hose of truth coming from the ground at all times, we could ask very specific questions and have high quality, reliable answers come back from the crowd, such that no experience goes to waste. And I think that's another sort of important point to make, is that currently our health intelligence, yes, it's based on populations, but the other thing that's a real challenge is the fact that we don't currently publish negative studies. So really only half the truth exists for exploration. All of the negative studies are not published. They're not available for exploration. And so in this three-zone model, the things that don't work are just as valuable to know about as those things that do work. And building a mechanism by which the AI has access to both, poor health, good health, everything in between, allows us to finally understand and have reliable access to truths that are personally relevant. So is this happening at all today? I just talk about a few of these. So these approaches, Hair DAO, Vita DAO, Athena DAO, DeSci, IndigiDAO, cannabis, are some of the areas where we're seeing early activity in this space. So Hair DAO, so apparently hair replacement is, an important phenomena for large groups of individuals. They've, the last time I looked, had 1,300 people already on Hair DAO. It's a group of men that try various products and record their success or failure with that product and make that available to the community, such that the entire community learns from each other's experiences, as we've just talked about. Same sort of model for Vita DAO, looking at longevity and pooling resources and experiences regarding longevity. Athena Health is a women's health DAO, looking at promoting women's health again in this collective model. And of course, DeSci is a movement that covers these types of activities, where the DeSci allows each and every one that contributes any amount of insight data or scientific graphs and tables, they can all be tokenized such that the original contributor is always attributed to that piece of information into perpetuity. IndigiDAO is another indigenous DAO that just got a grant from, I think, Robert Wood Johnson, because these are, again, you got to think of who are the early adopters of these behaviors. The indigenous folks have a strong culture around ownership of their insights and their understanding of the world. And so they're, in a sense, natively migrating towards these types of models to have good access to their own intellectual property and understanding at all times. And then, of course, cannabis is another area where we see this behavior, because cannabis, in a sense, has been kicked out of medicine to begin with because it's a natural product. And so you have cannabis users who are benefiting from the fact that we have regulation that requires cannabis products to be documented in terms of seed to sale. So we have the DNA of the seed itself and that went into the product. And now individuals are contributing their own health experience with that product. So Chan, if you're using a product for sleep, you can document how well that worked for you or not. And then this happens at scale across hundreds of users. And pretty soon we know which seed to sale DNA actually works well for sleep for which type of person at what time. And so that is a good understanding of, how detailed that information could be in the future if there was a safe and secure way to secure the details of our lives. So I'm trying to keep this short so we can get to questions and answers if there are any. But I think it's important to think about this new model of the largest company in the world being a different type of healthcare cooperative, where it takes advantage of the fact that the current system has a massive amount of imprecision in it that we explained when I talked about providing a prescription to 200 individuals over 5 years in order to prevent one adverse event from happening. We get it that AI is here. It's missing the training data. That's, I think, a huge, important point from this discussion, and that we are at the cusp of requiring and delivering on a new trust architecture that may result in something that resembles the 3-zone model. That's the proposal here. We have some regulations in place already here in the US, such as HIPAA. HIPAA is a privacy act that doesn't cover individuals. So we as individuals, we're not covered entities, so we have the license to do with our data as we choose. And so that's ideal. And then the 21st Century Secure Act plus new regulations that are coming up in the next little while ensure that individuals actually have access to the information that resides currently in healthcare settings, so in clinics and hospitals. And that enables us to have the regulations in place to enable the type of future that we're looking for here. And then that's just a couple links to follow up on for the group. But happy to stop here and entertain discussions, comments, questions, whatever the group is interested in.
Yeah, thank you very much, Brigitte. Any questions from the audience? Feel free to post the question in the chat or just open your mic. Yeah, Trang. Did you have a question? I see that you have your hands up.
Are you talking to me, Jack?
Yeah.
Oh, okay. First, I would like to say that the presentation was wonderful. Thank you so much, because I'm also interested in healthcare with innovative technology. My research interest is in information governance, and I think it would be great to know your opinion about, is there any unique or distinguished characteristic of health data that make it different from other industry, and which can make the application of innovative technology different?
So if I understand you correctly, Trinh, then what you're asking about is what is health data versus healthcare data? And
maybe you can clarify that two concepts as well, because like from a person outside the healthcare industry, health data, healthcare data can be, I'm quite confused with that.
Right. So actually, but you are totally fine being confused, because we called our industry healthcare when in fact it's illness management. That's the industry. And so the data that exists inside of the industry that's currently called healthcare is illness management data and billing data. And when we think of our health span throughout the decades of our lives, very little of our health happens in clinics and hospitals. Those are episodic events in our life. And hopefully with this new health system that we're building, this biggest company in the world, according to A16Z, the clinic and hospital visits would diminish to almost nothing, to hopefully no one ever has to spend time in a hospital. And that the data that comprises the ebb and flow of our health expression is the data that we've been talking about, such as movement, nutrition, sleep, social cohesiveness, air quality, and other things that currently are not digitized well. They exist in our lives, but they exist because we are physical entities first. We're not digital first. They're physical. But the interesting part about these physical phenomena is that we, the people, are still managing them, are still controlling them. So, and they don't exist in industry or government yet. So we have this opportunity for a universal mechanism by which everybody, regardless of where they find themselves on the planet, which government they find themselves under, it might be possible to build a universal personal data protective system, a new trust architecture that could work for everybody everywhere. And that it would house that kind of data that we're talking about that isn't illness management or billing data. It's movement, nutrition, sleep, social cohesiveness, air quality, pesticides, other environmental exposures, microplastics, etc. And that this is the big opportunity here for new entrants to build a health system that is different than the one before.
So your research is based on the overall health data rather than the illness management data for now.
Correct. Correct.
Mhm. And given that, is there any unique characteristic of the health data that you see that differ it from other industry?
Well, the unique characteristic is the ownership currently. Unique characteristic is it's in the domain of the individual. It's under the control of the individual, and the fact that it is largely under digitized at the moment. It exists in physical form. And that the other unique characteristic about it is that if it is the only data that will allow AI to align itself with humanity into perpetuity. You cannot ask AI to align itself with humanity using illness management or billing data. That data will be insufficient. And so as we tinker with these new technologies such as AI, it's important to have a pathway towards alignment, because I think, you've heard Yuval Noah Harari said it well on a Lex Friedman podcast, where he talked about AI should not be considered simply a tool, because it has properties that are very different from what we think of as a tool. One of those properties is that AI can have ideas, and the printing press is a tool, and the printing press could print every idea that humanity came up with, but it could not come up with one idea itself. AI has ideas. The other property that's different about AI is it can make decisions. And of course, humanity can build things like atomic bombs, but they cannot decide to go off or in which direction. They rely on human management to make those decisions for them, versus AI, it can make decisions by itself. And so I think it's important to understand that this massive hole in terms of the missing health data is something that we require, not just for better health or for an economic benefit for ourselves and each other, but also fundamentally we require this for AI alignment into perpetuity.
Wow, thank you so much for your insight. If I still have some space, another question would be, do you see a need or a future of integrating the illness management data with overall health data to create a more holistic system?
Totally. That's why I think your home base, your particular home base, would have your health data plus your illness data, plus your billing data, plus whatever else you want to store there as well, so that there is a complete longitudinal history of the things that you have interfaced with throughout the decades of your life. And I think that sometimes these concepts get a little bit mixed up with digital twins, and we're not really talking about a digital twin here, in that we don't want to have you exporting yourself in a digital form at any time. That's too high risk. That's too all or none. But think of your health expression as generating digital twins in a specific manner. So if we get back to the migraine example, for instance, say you have migraines. So you spin up a digital twin of your specific migraine spectrum and the things that may be associated with it according to your lifestyle. And you send that out to the zone 2 to say, please find other migraines that are similar to mine and provide me with an understanding of what works best to make sure these are minimized throughout the decades of my life. And so think of your digital twins as these types of fractional representations of yourself, not your whole self, that go out and seek fractional insights that are specific to you at the end of the day, while protecting your individual identity at all times.
Thank you so much for your response.
Hopefully that's helpful.
Oh, super helpful.
Okay, thanks.
Any other questions from the audience? If not, I have a question. So, Brigitte, you mentioned that there are a few DAOs in the healthcare data sharing space. And can you comment on the status of these DAOs and what do you see will be the next steps for these DAOs to develop? Because I know that some of the DAOs have been existing for quite some time, but I'm not sure if they have really made substantial progress.
Well, I think the challenge here is this is new territory and it's still really early days, and governance models are difficult to tease out, and a lot of the DAOs are basically building themselves. It's like building the plane while you're flying it, right?
Yeah.
And that comes with challenges. So increasingly, we're starting to see more and more of the components that are necessary for governance being built so that you can just pick them off the shelf to say, we would like to govern ourselves this way. Here's the package that does voting rights. Here's the package that does another function. And so it'll become easier and easier to, I think, learn from each other's mistakes. Right now, we're all still in that early tinkering model where DAOs start off in one direction with grand and aspirational plans, and then get tripped up by things that they didn't anticipate. So the only way you can find out what you didn't anticipate is by executing and see what needs to be done. So I think that DAOs have, because in early days we tend to highlight the things that don't work rather than the things that do work. That gets the most press, and I anticipate that over time these will become much more streamlined. They're way less expensive than setting up a corporation, and they have much more a much greater design space to build and design collaboration models that work for them for their specific purposes.
Mm-hmm. That's great. Thank you very much. And then there's a question from Juliet in the chat.
Mm-hmm.
And also just say it, just try to write it down sometimes to clear my thoughts. So I was wondering if so you mentioned AI making recommendations for like specific headaches or something. So I just wonder, like, how does AI, like, what kind of data is used for those suggestions?
So, and I appreciate you bringing up that question, because we should have really stressed that the AI is not a recommendation engine, right? It acts just as a transparency engine that says, oh, you have this this signature migraine that you've built your digital twin around. So, and you've sent it out to me, and I found, and it'll be very transparent, I found 4,677 people with very similar characteristics that are that have a 95% concordance with your type of migraine. So it'll tell you it found this many migraines that are similar to yours, and then it'll stratify for you which interventions are the most used and which ones are most effective. So that at the end of the day, it's not telling you to do X, Y, or Z ever. It's just saying, I found these incidences of something that you are interested in understanding. And that this is the amount that I found. These are the modalities that are being used by these participants, and these are the successes that they're recording or reporting. And then everything is up to you. You ignore it all. It basically comes with a confidence interval associated with the information. You know, if it can't find many people that have an experience that you're asking about, the confidence level will be lower, saying that, you know, I only 140 people with X, and therefore the confidence with respect to their experience is relatively low compared to if there's many people that can validate that the same experience is happening over and over and over and over again. Then you can pretty confident that the information is likely to be closer to the truth. At the end of the day, the AI should not be making recommendations, but I think all of us deserve to have visibility into the things we would like to know. You know, if I'm expected to have a knee replacement, I'd like to know what that's going to cost me. And I can go to my cohort and find out exactly what that cost. But otherwise might be, you know, very challenging. Go ahead.
Yeah, I was like almost like thinking like garbage in, garbage out kind of problem. So with the, yeah, if it would have been based on existing studies, or you come back to the same problem actually that you started off with, like very biased view of who are the participants and the outcome. So like white males, I think, are the common denominator for like medicine studies, right? And so how does this apply to other populations and so forth? So really interesting. But then also I wanted to ask you about bias. So you mentioned that maybe for if you are tired or whatnot, and you would self-report. So how would you go around bias and bias of data and data input, and then the recommendation that come out of it? Because I can feel like a headache is like a 3, but for someone else it might be a 10 or something, you know, and then the recommendation will be quite different.
Exactly. And so this is something that doesn't go away, but I think the technology allows us to do a better job than we've done thus far. So for instance, the ability to have identity safeguarded and secure, and being able to prove that, you know, this is Chan's headache, and he did see a provider for this because his phone shows that he was at the location, and that this is a real prescription that he got, and this pharmacy is a real pharmacy, etc. So the ability to have that sequential blockchain-based provenance of information provides us with a place where we can improve. I don't think we'll ever eliminate, but we can improve substantially the amount of misinformation that the AI is training on, that the AI can train on verified information. And again, that the verified information will have a gradient associated. You know, is this highly verified because it's been triangulated from 4 different directions, or is this not highly verified because we weren't able to triangulate it at all? We just have the person's opinion on the pain, right? Like pain's a perfect example of something that's really hard to triangulate. You got one source, that individual, and that's it. Well, actually, no, you can, you know, increase blood pressure and increase heart rate associated with pain. So you can triangulate that to some degree. But I think that these tools allow us to do a much better job, and we would expect this A16Z, largest company in the world, to do a completely better job of utilizing and enabling highly verifiable data points for AI training. And especially, you know, your point around the fact that, yes, the current intelligence is population-based, and it's gross because it can only offer average, but it's also, you know, populations that don't exist for many of us, you know, being female or of other ethnic categories, or, you know, other sort of lifestyle choices. There's like no information. So I think one of the beauties of this new opportunity to build health differently is everybody's experience is so valuable, because we are uniquely different from each other, and without, as I said, access to what works as well as what doesn't work, you know, we won't have access to the truth. So all health expression, regardless of, that individual location or, any parameter, every health expression is very valuable to all of us. And so
Yeah.
it has a unique way of kind of democratizing a future whereby we don't live in isolation. We actually live with a crowd in our pocket, and that crowd helps us navigate through the intricacies of our future together to make sure that we are not stepping over stones that have been stepped over before. Like, let's make life easy. If we already know about this pothole, let's work around it. Right.
I think data triangulation is definitely key for this one. Having the data from the doctor as well. Because just imagining like myself sitting on Google and like typing in what a headache could mean, right? You get like so many different suggestions. But having the triangulation of like different data points and maybe self-recording over a period of time, that would help definitely with data accuracy, and then also with potential like disease prevention and so forth.
Absolutely. That's a really important point. And is
Thank
that
you.
an area you're working in?
No, but I got exposed to it. A friend of mine is working for healthcare and AI and built his own companies around these. Yeah. So I got a little bit of exposure to it, but I'm a supply chain researcher looking at supply chain transparency and the use of blockchain for that. So quite different.
Well, and supply chain, I think, is the provenance of all data at all times, right? So I think supply chain touches every use of data.
Exactly. At the moment, it's still very centralized among actors. So yeah, I'm looking at decentralized information sharing and how that might work.
Great.
Yeah, on that note, I have a question. So we talk about data triangulation, data access, but in the healthcare sector, there are lots of regulations around data access. I think it's not that easy for a private organization or even a DAO to access all the health data that they need. Currently, I think a lot of the healthcare data is owned by a custodian and custodied by doctors or health authorities, right? And I think there are a lot of regulations protecting that ownership and custodianship. So with that in mind, how can we move towards this decentralized data infrastructure?
So I think we touched on it very briefly towards the end, that at least in the US, we have the 21st Century Cures Act, which provides each of us with the ability to request our data, and healthcare, complies to various degrees, sometimes 30 days, sometimes 90 days. So each of us has that right instilled. And what we're talking about is something that AI, again, could fix very easily, because my requesting of my data in the US is going to be exactly the same as everybody else on this call. So you could have an AI that says, okay, I need you to fill out this form. I need you to sign it here. I need you to request and make an approval for this request. And then I will send it off to this authority that will have to process it. And so you can have these AI agents, once built, work for everybody at all times in a similar jurisdiction. And so that the hard work that I would have to go into to ask for my data and get it put on my home base could be automated to a large degree. And once that's automated, then, like I say, everybody on the call could have the same level of ease of, because it's all just processing, basically. The important part is you have to have the rule in place that says you have access. So then the custodian, getting it from who's ever custodying your record currently, that process is a process, and you can stick an AI on that and make it happen, and just fill out your forms and you can sign it and it'll make it happen for you. So I think those sorts of onerous bureaucratic tangled messes that are part of our daily life, those are probably one of the first places where AI is just going to clean that up for us. Like, okay, that's what you want. You want your record. Here, this is I've been built to get that for you.
Hmm. So I see that there's a note from Daniel in the chat. Again, I'm not sure if you want to address this, so I have a few words about this.
So let's see. It says, hello, awesome. If someone would be interested on patient-owned verifiable biosamples and biodata digital twins using blockchain technology, bio NFTs, please let me know. Oh, great. So he's put an example in there as well. Hopefully everybody can just cut and paste that. Because I think that will be ideal as well. You know, having that ability to have your own tissue, find other tissue that's similar, and figure out in silico what worked for a particular cancer versus another one. That would be ideal, to be able to have your own biosamples that are unique to yourself be available for AI perusal.
Yeah.
And Daniel, you were going to say something?
No, just to thank you. Sorry, I am in Japan and it's very early. I cannot talk too loud. I'm sorry, but I just wanted to tell you that awesome presentation, and just if there's a way that later on we could collaborate, that would be super awesome.
Likewise, I would very much enjoy that.
Thank you very much, everybody.
Thank you. And on that very positive note, we have arrived at the top of the hour. So thank you again very much, Brigitte, for the wonderful presentation. As Daniel mentioned, also I think many of us probably have the same feeling as Daniel, that we probably want to collaborate with each other, right? So if you want to carry on the conversation either with Brigitte or with other members in this call, please feel free to reach out. And later on, we are going to upload the recording of this presentation to our YouTube channel and to our website. So if you want to watch it, if you want to listen to Brigitte's presentation again, you can go to our website or YouTube channel. Okay, I guess that's it for today. Anyone has last word for this session? Brigitte,
Yeah, just to
anything?
mention, you can reach me on LinkedIn at Brigitte Piniewski, or I just dropped my email in the chat as well.
Okay, sounds
And
great.
then, Trin, you were going to say something?
No, I was just going to say, oh, Chen, yes, yeah.
I'm just clapping for such a wonderful presentation.
Thank you.
All right, thank you very much, Brigitte, and thank you everyone for joining, and have a great day.
Thanks. Bye now.
Thank you. Bye-bye.
Bye-bye.